Morning, folks. How's it going? Yeah, I think I'm good. It's my first time in room 68 in quite a while. Good to go? Minister Asagwara and I would like to begin by acknowledging that the message that we're sharing today is being sent out across to the healthcare workforce who are working across the traditional territories of the Inishuk, the Cree, the Dene, the Dakota, the Métis, the Inuit, and the Anishinaabe nations within Manitoba. I also wanted to begin with a note of support for Coach Rick Bowness. While respecting he and his family's privacy right now, I think that we've all been very moved by what we've heard. We just wanted to take a moment to offer moral support to Coach Bowness at this difficult time. And of course, as always, go Jets go. So I'm Wab Kinew. Good morning. I am the Premier of Manitoba, and today I'm very proud to be joined by your Deputy Premier and the Minister of Health, Seniors, and Long-Term Care, Uzoma Asagwara. We're here today to talk to you, the healthcare workers at the bedside across this great province. And our message is simple. We need you. We need every nurse, every physician, every healthcare professional, every healthcare aide. We need you, and this message today is being sent specifically to you to ask with the greatest of humility that you work with us as we get down to job number one that we've been tasked with by the people of Manitoba, which is to fix healthcare in this province. We know that you have worked tirelessly to take care of us, and now it is time for us as a province to take better care of you. Our commitments to fixing healthcare start with you. Anything we want to do in healthcare, whether that's in the emergency rooms, the long-term care settings, in the community, they only happen if you are there caring for patients and doing the excellent work that you do so well. Now, we have heard countless times over the years, and in particular over the past few months, from you at the bedside, in your workplaces, on your doorsteps, about how difficult it has been to work in the healthcare system here in Manitoba. And so as a first step, I want to say that we hear you. And we are committed to responding to the priority areas that you have identified need urgent action so that we can work together to deliver good quality care for patients in Manitoba. Our government is committed to giving you the respect and the resources that you need and that you deserve. And Minister Asagwara and myself are committed to not only providing the resources, but also to providing you with the decision-making power to care for patients in a good way. That means that we are going to respect the years of training that you have put in to developing your careers, as well as the years of experience that you have developed in caring for patients across Manitoba. And it is on that foundation of respect that this message that we're sharing today is built. We received a mandate from the people of Manitoba to fix our healthcare system, and we know that this task is going to be very challenging. However, we also know that the way we do difficult things here in Manitoba is by working on them together. And so it is with that note of humility that we're asking for you to work with us to accomplish this important task. To those folks who are working on the front lines of our healthcare system today, I ask that you keep working on the front lines of our healthcare system while our team works to bring you the support and the resources necessary for you to deliver excellent patient care and also to make your life at work better. To those folks who've recently left the public healthcare system in Manitoba, either to retire or to find better work-life balance in other places, it is with the greatest humility that I would ask you to consider coming back to work on the front lines of our public health care system. Along the way, I am also going to ask for some patience. The task before us of repairing the damage that has been caused to our healthcare system is going to take years to accomplish. But we are resetting the relationship right now. And we're asking for the time and the ability to collaborate together so that we can do the one thing that we all share in common, which is to deliver the highest quality patient care for the people of Manitoba. Now, we're just as ready for change as you are. And I know that Minister Asagwara is not only going to be able to lean on their years of experience as an MLA on the healthcare file, but also years at the bedside, working alongside you. And that's why I've asked them to lead this important task. But in reality, I have asked every single member of our team to work together to improve healthcare here in Manitoba. And that includes not only moving outcomes in the healthcare system, that's about starting the conversation about moving health outcomes in the community. And of course, even on files like affordability, we're hoping to deliver more financial freedom to you in the auspices of eventually being able to make our communities healthier in the long term. So our province is at its best when we work together, and our government is committed to building a relationship with you that is positive, constructive, and focused on respect. So one of our first acts of government is to release this public letter to you, the folks who bring our healthcare system to life. And the idea behind this letter is to send a message to you that we are serious about improving healthcare and that this is the beginning of a new working relationship in Manitoba's healthcare system to improve things for patients, but also to improve things for you on the front lines. So once again, it is with that tone of humility that we are asking for the opportunity to work together to make life better for people in Manitoba. Thanks very much, and I'll invite Minister Asagwara to make their opening comments.
Thank you, Premier. Now, as Minister for Health, Seniors and Long-Term Care, and as the Deputy Premier, I want to take this moment to say thank you to the healthcare staff who are keeping our healthcare system afloat through some of the most difficult times that we have seen. I also want to promise you, the Premier and our team are ready to work with you. I know what it's like to work on the floor as a nurse. I became a nurse because I wanted to help people heal. The hours can be long and it can be very challenging work. You're tasked with providing care to people in some of their toughest moments as individuals and often as families. But as healthcare workers, you also know how rewarding that work is, day in and day out, making a positive impact on the lives of those you provide care to and their families and sometimes communities. After years of mismanagement and mistreatment by the PCs, we know it's gotten harder to do your jobs and take care of Manitobans. I've heard from you and I've heard from your colleagues across the province that our healthcare system is in chaos and that working on the front lines has been exhausting. We're here today to commit to you that our government is going to change that with your help. We're going to make your life better by changing the culture of healthcare. We're going to hold management accountable to measurable improvements for morale and for patient care. We're going to make sure that you get the respect and the credit that you deserve for doing the work that you do and coming up with the creative solutions and bringing forward strong ideas. And I want to say to each of you, no one in our province places blame at your feet. We know that you've worked so hard to keep Manitobans healthy. Even when the government was working against you and making it harder for you to provide care for Manitobans, we know that you've been doing your absolute best and providing the care that Manitobans count on you for. I've been at the bedside. I know that you have the knowledge and the skills to care for our citizens well. And now it's our job as a government to treat you with the respect and the support that you deserve in order to keep providing that care. So, while we get to work, I'm asking all of you to keep showing up. While we're putting in the work, we're asking you to continue to show up as you've been doing for Manitobans and provide that care across our province. We are going to make things easier. We're going to fix what was broken in our system, and we're going to do things better and fix things together. Thank you.
Thanks very much, Minister Asagwara. So we're happy to take questions on our open letter to healthcare workers in Manitoba, and then on to other topics as you see fit.
In the open letter, just reading through I haven't seen the letter, but I've seen the news release on the letter. You're reiterating some of your campaign promises. Is there anything concrete you're offering in the letter?
Do you want to go first?
Sure, yeah. We do know, having heard from healthcare workers for quite some time now, that one concrete step that we must take is resetting and repairing the relationship with healthcare workers. They've made very clear to us over the last several months and even in recent weeks and days that trust has been broken due to the previous government's mismanagement of healthcare and mistreatment of healthcare workers. And so it is a very real step to take and a very important one to commit to strengthening the relationship with healthcare workers, to repairing the trust that's been broken and treating them with the respect that they deserve but have not seen for a long time, unfortunately.
And in terms of resetting the relationship, and you've spoken about allowing them input, is the government setting up any new advisory committees or bodies where healthcare workers can have more say on any restructuring that might be done?
First, I would say to that, we've been listening to Manitobans and listening to healthcare workers for quite some time. And that was reflected in our campaign. It's reflected in our coming out today and making this commitment and, sharing this open letter to healthcare workers. That is, it's a concrete step. And it's a reflection of what healthcare workers have been making very, very clear to us. Premier?
Pragmatically, though, how are you going to allow healthcare workers to have greater decision-making or more input into the system? What does that mean exactly? I mean, that sounds nice words-wise, but what does it actually mean? How will a nurse or an allied healthcare worker or a doctor have greater input into decision-making?
One thing I would say is that we look forward to providing opportunities to frontline healthcare providers, to doctors, to nurses, to allied healthcare professionals, to have their voices heard and their expertise respected and to be part of the way that we address things moving forward. Our narrative, the way that we've communicated with Manitobans has evidently resonated with Manitobans and healthcare workers, again, because it's their voices that we have been listening to and the relationships that we've been building that have been reflected in the steps that we've been taking. And so, this is a big opportunity for us as a government. It's one that we take very seriously to ensure that the relationships we've been building with healthcare workers is ongoing. And there are going to be opportunities for healthcare workers and experts locally here in Manitoba to work with our team. And, we're going to keep echoing our calls and reiterating our calls to Manitoban healthcare workers so that they know that our door is always open and we want to work with folks to improve healthcare in our province.
So stay tuned for the details, or is there going to be more concrete details? Because you're speaking at a very high level, sort of in principle, but, practically speaking, how would it work?
Sure.
And if you can't tell us that today, are you telling us that there'll be more details to come, whether it's advisory councils, like Steve mentioned, or some other mechanism?
Yes, there will definitely be many more announcements on healthcare to come from our government, as you would expect. What I would say, though, is that our team is a listening government, and we're also a team that listens, in particular, to the evidence. And there's a few points that we've seen in the evidence when it comes to improving morale and improving the outcomes for those who work on the front lines of the healthcare system. And that's why we're speaking to you, the healthcare workers, today as one of our first acts after being sworn into office. Specifically, when we're trying to tackle a task as gargantuan as turning around the ship that is the Manitoba healthcare system, we have to have all hands on deck. But one of the things that we've seen from the evidence is that in order to have a strong working relationship and to be able to build the buy-in and the support from this team of people who are working on the front lines, that we have to have a values level conversation first. We began to articulate that through the campaign, but today we are sending a clear message that this is our top priority in government. You, the people on the front lines of the healthcare system. One of the other crucial pieces of evidence that we've seen through our investigation and investigations into how do you move outcomes for those working on the front lines of healthcare staff is that you need to reinvest decision-making power at the front lines. And that is something that we're very committed to. And so today, we are beginning the work of fixing healthcare with communicating our values. Values of listening, values of respect for your expertise and for your experience, and a commitment to working collaboratively together. Future steps will involve investments in staffing up hospital beds, will involve streamlining the healthcare bureaucracy to return decision-making power to the front lines, will involve opportunities for us to spend time with you and hear your priorities from the front lines. These are all things that we are going to roll out in the coming days and weeks. But first, before we do anything else, we think it's absolutely critical that we show you respect and send you the message that we need you. And it's with the greatest of humility that we're asking that you continue working to serve the people of Manitoba while our new government stands up our agenda for fixing healthcare in this province.
When can Manitobans expect to see a strategy or an action plan on staffing up the healthcare system?
I think you're going to see in the coming weeks the plan for staffing up healthcare begin in the areas where we are seeing some absolutely critical needs. And that's both the emergency rooms because of the wait times, which are at levels that are the highest on record across the system, but also because we know that there is respiratory virus season on the horizon, and so there's an urgent need to staff up in those areas. But the details of those initiatives will be coming very soon, and they're one of our high priority areas for our new government.
What will be the fate of the diagnostic and surgical task force?
At this stage, we have asked them to not commit any new intents or commit to any new initiatives until we get a handle on the situation here. And getting a handle on the situation is first and foremost about understanding the needs of you who are working on the front lines of the healthcare system, but it's also about examining in a global sense, how are we going to reduce the duplication of bureaucracy at the highest levels of our healthcare system so that we can return decision-making power and resources to you, the nurses, the physicians, and the others who are working on the front lines, including healthcare professionals and healthcare aides.
Can patients continue to be referred out of province at this time?
Existing arrangements are being honored. So within the existing contracts that have been set up, if somebody's in the referral process already, then they are going to be able to see that process through. One of the things that has surprised me coming into government is the lack of financial oversight of the outgoing administration, including when it comes to healthcare system delivery. And so in addition to a healthcare mess, which we inherited from the previous PC government, we have also inherited quite a large task in trying to clean up the provincial finances. And so in addition to the investments that we know we need to make, there are also going to be important cleanup operations along the way as well, because in the lead up to this provincial election, the outgoing administration was deeply irresponsible.
Can you give us some examples of that?
I would say that we're going to have plenty more to say on that in the coming weeks.
Je vais vous reposer des questions qui ont déjà été posées en anglais.
Ouais.
C'est vrai que cette déclaration que vous faites aujourd'hui manque un petit peu de concret. Ce sont des mots, des affirmations qu'on a déjà beaucoup entendues pendant votre campagne électorale. Pourquoi aujourd'hui c'est plus différent qu'il y a quelques semaines quand vous faisiez exactement les mêmes affirmations aux travailleurs de la santé ?
Il y avait quelques semaines où ce qu'on était les candidats, les candidates sur une campagne électorale. Maintenant, nous sommes le ministre de la Santé et puis le premier ministre du Manitoba. Et puis, ce qu'on a vu en parlant avec les experts et puis en écoutant tout leur avis, c'est qu'en commençant un grand travail ensemble avec un nouvel partenaire, qu'on devrait commencer au niveau des valeurs. C'est en disant que nous sommes ici pour vous, les infirmières, les médecins, pour tous ceux qui travaillent dans le système de santé. Et maintenant, si nous sommes d'accord à ce niveau des valeurs, qu'on pourrait ensuite partager les différents plans et puis développer ensemble les prochaines étapes pour guérir le système de santé dans le Manitoba.
Vous dites que la confiance a été brisée, trust has been broken, c'est ce que vous avez dit il y a quelques minutes à peine. Est-ce que vous comprenez que faire des annonces pour dire je comprends les travailleurs de la santé, ça ne suffit pas au bout d'un moment, il nous faut des annonces concrètes pour savoir ce que vous allez viser en priorité. Et si vous voulez entendre le point de vue de ces travailleurs, est-ce que c'est une plateforme qui va être lancée? Comment les travailleurs peuvent s'adresser au gouvernement manitobain de manière simple?
Bien, nous sommes ici toujours pour vous, ceux qui travaillent dans le système de santé. Vos idées, vos messages des hôpitaux, des cliniques, tout partout dans la province sont importants pour notre équipe. Alors, s'il te plaît, si vous avez des messages, des choses qu'on devrait entendre, s'il te plaît, les partagez avec nous. Mais une des premières actions de notre gouvernement est de lancer un message à ceux qui travaillent dans le système de santé que vous êtes tellement importants et nous demandons de manière respectueuse si vous pourrez continuer de travailler dans le système de santé. Et ceux qui ont déjà pris leur retraite ou peut-être quitté la province, nous demandons de faire un retour ici au Manitoba pour nous aider dans ce temps. C'est un temps important, oui. Il vont avoir beaucoup d'étapes concrètes, mais la première chose, ça doit être une conversation au niveau des valeurs et une demande respectueuse à vous, ceux qui travaillent dans notre système, de travailler avec notre nouvel gouvernement.
Regarding your allegation that there's a fiscal mess, are you asking the Auditor General to investigate any of the programs announced in the last year of the PC government, the checks that were mailed out, those sort of programs?
Well, I don't have any news to share along that line.
You were talking mostly about it being in healthcare, so was there a lack of due diligence, for example, around the diagnostic and surgical task force? I mean, suddenly they had a budget, they didn't have a budget to begin with. There's monies expended, it's a new layer of bureaucracy that was created. Is it
New layer
around
of
that?
bureaucracy.
Is
Certainly that's one area. There are other areas outside of health as well, in which you're going to see that, there are serious concerns. But one of the most serious concerns that I've heard articulated was a lack of oversight around decision-making of this task force, and in particular, that they were making decisions about spending without having a system-wide view of what's happening in the healthcare system. So I think all of us, just as lay people, would hear that situation and say, that seems like it might be an issue. So where we're at right now is setting to work and trying to understand the situation, and then, of course, to figure out how do we solve it.
You at this point are just telling them not to create any new contracts.
Hit the pause button.
But they're still operating, they still have their money at their disposal.
Well, we've hit the pause button, meaning that they can't enter into any new financial arrangements. But as I stated previously, if somebody was in the process of receiving a referral or was even maybe going to receive a referral in the future, those avenues are still open.
Is Dr. Peter McDonald still the co-chair?
We haven't made any changes to the process. We're still at an information gathering phase, and I'm just articulating in a spirit of transparency some concerns that we've heard.
You mentioned earlier that you're going to hold managers accountable in the healthcare system for outcomes. What does that mean exactly? I mean, are managers going to face consequences for not meeting benchmarks like wait times, where they get demoted, lose their jobs? What does that mean to hold them accountable?
I think that what we have in mind is not at the local manager level in a given personal care home or a given hospital, but rather it's at the health system leader level. And so this would be the folks who are in charge of service delivery. And again, we want to be fair, we want to have an open and positive, constructive relationship with these folks, but it's important to understand that our first priority is the people at the bedside. And so we have to work together to improve life for those folks at the bedside. And we are going to be direct, and we're going to have conversations around accountability when we see potentially, again, I hope this doesn't happen, but if we see potentially examples where those standards aren't being delivered.
Can you give examples of what kind of positions? I mean, hospital presidents, CEOs of regional health authorities, executive members of regional health authorities.
I think it would be unfair of me to name specific titles or either of us, but what I would say is I think the accountability always has to start at this level, the elected level. And so the first person that I'll be holding accountable is myself, and then with the greatest of respect, our new Minister of Health is also somebody that I'm going to be having a lot of these conversations with.
What would be the measurables? Like, what categories would you be looking at that level?
Well, broadly, we're talking about improving outcomes for patients and improving staff morale. And I think the specifics around the indicators by which we measure that are things that we should have conversations internally around first.
There's been efforts, over the years to fix the healthcare system. I'm talking about the Peachy report, the 2017 wait time report. Have you read or reviewed those reports? And I guess if so, is there anything that you're taking away from it that you would use?
Oh yes, we've reviewed it all, and I'm grinning a little bit because I was at this table in 2017 with an alternative throne speech articulating how the proposed consolidation of emergency rooms was going to result in a lack of beds system-wide in Winnipeg. And so we have been monitoring every step of the way the proposed plans, the ways in which the lack of management by the managerial oversight by the previous government led to those plans going off the rails. Minister Asagwara in particular has been, I guess, triaging, to use a double entendre, the concerns and complaints and cries for help from the front lines. And now it's with the greatest of humility that we're hoping to action all of those experiences and knowledge and bring about a better plan for healthcare for Manitobans. But I think what we've learned along the way is anything we want to do in healthcare has to start with you, the folks who work in healthcare. And so that's why we're releasing this open letter today. And we're asking with the greatest of humility that you work with our new government to do the thing that we all want to do together, which is improve life for Manitobans.
I guess there's this, there's doctors and some that have seen those reports. They say there's good things in it, and some are skeptical of the plan to reopen ERs. Are you overruling, I guess, those expert opinions, or do you think the expert opinions you've heard have more weight or are better?
I think you don't need unanimity in order to forge a consensus. And I also think that having a dissenting opinion as part of the conversation makes the decision-making process stronger. And so I welcome the opportunity to engage with folks who may be good faith skeptics of some of the plans that we've put forward in order for us to strengthen, because the immediate follow-up, I think, from our side will be, all right, given a specific flag that you've made, what is the specific impact on the healthcare workforce or on the capital needs within this setting that needs to be addressed? And then we can identify that weakness and then put it into our plan going forward in terms of something that we know we need to fix or we know we need to reinforce, or something that is perhaps a flag going forward into the future. So by all means, I think that we have received a lot of expert advice, which is very constructive and positive, and we're going to work really hard with those folks in terms of setting this new relationship with you who work in healthcare. We're also going to work with the folks who have dissenting opinions, so long as they're good faith dissenting opinions, in order to build a stronger healthcare plan that works for everyone in Manitoba. And here I want to pause to make a specific point, which is the idea of retribution in healthcare for those who speak out from the front lines is now over. You who work on the front lines of our healthcare system should feel free to speak out about the needs within your specific setting, about the needs system-wide. Our team is strong enough to be able to handle the truth from the front lines. And so we want to work with you to improve things for Manitobans. And I think all of us in our own careers and paths to the offices we now hold have learned that it's only by confronting the real truth and taking steps to address it that we will be able to deliver improved outcomes. And so very appreciative of the question, because it does give us an opportunity to signal one of the early areas in which we want to reset the relationship with folks in the healthcare system.
So can a frontline nurse talk to the media, give us their name on the issues they see in healthcare?
Yes. They always could, but it was the culture of retribution which stood in the way of that. And what I would say is that we are going to focus on addressing the problems instead of what the previous government did time and time again, which was addressing the whistleblower.
You complained quite a bit when you were in opposition about private healthcare, in that some aspects of the healthcare system were delivered through the private sector. At various times you complained about that. Will you be scaling back the delivery of any of those services that are provided by the private sector?
I think right now our message is to the healthcare workforce in the public healthcare system, which, to your question, does include some private settings, whether that be the family physician's office or other clinics which form part of the overall healthcare system as defined by the Canada Health Act. And so I think our team is going to take a common sense approach. We're going to work within this hybrid environment so long as it's within the Canada Health Act umbrella, in order to deliver good quality care for you, the people of Manitoba, and to make life better for those of you who work on the front lines.
You're not adverse to it on principle or philosophically?
Well, I'm going to trot out one of my old lines, because I don't think I've used it with you in the past, but it's to say this. So my wife is Dr. Lisa Monkman. We have a range of companies at work within the public healthcare system. On the one side of the spectrum, I'm a big fan of the work that the Lisa Monkman Medical Corporation does. On the other side of the spectrum, there's maybe some other players, Big Pharma, as an example, that some folks in our province might be skeptical of the motivations around. So for me, if we have this spectrum of players within the healthcare system in Manitoba, it's really a question of balance. Where is the right spot along that spectrum where we say this is appropriate within our healthcare system and it's going to deliver better outcomes for people in Manitoba? And I think the guiding principle for how we arrive at that balance is the Canada Health Act.
So the previous government was contracting out, for lack of a better word, a lot of surgical procedures like cataracts and others. You took issue with that at the time. It all falls within the Canada Health Act because the patient's not paying. The government is simply putting out tenders to the private sector rather than to publicly run hospitals or not-for-profit hospitals. You took issue with that at the time. Do you take issue with it now?
I think one of the specific areas where I took issue was when the Diagnostic and Surgical Task Force and the previous PC administration seemed to be shortcutting players in the public system, like the Sleep Disorder Center, and paving the road for other arrangements, including with private providers, to step in. And my concern there, then, as it is now, is that it's actually not cost effective, and it actually slows things down. Probably increases the wait times for people to get services out of the Sleep Disorder Center. So I would say where our critiques and opposition and where our focus as government today align, and there's a great deal of continuity on, is the fact that we want to get people seen sooner when they need a test and when they need a referral to a procedure. And I think the best way for us to do that is to first look at the public system within Manitoba and ask how can we deliver those services here.
What about expanding the scope of practice for pharmacists? Where does that fit into this equation?
Jump in there.
Sure. We have already indicated, Premier has indicated that we want to leave no stone unturned. We want to make sure that folks in our healthcare system are working to their full scope of practice, and we want to work with healthcare professionals across the board to find creative ways to strengthen our healthcare system. To the earlier question as well, it's so important that we strengthen our public healthcare system. and that we invest in making sure that our public health care system is strong for all Manitobans to access, be it, emergency rooms, be it accessing, different clinics, et cetera. There's a wide range of aspects of our public health care system that have been undermined by the former government and that we're not invested in. And, you're talking about pharmacists. That's one category of professionals who, have not been engaged by the previous government. And our team is committed to making sure that we're listening to the folks who provide care to Manitobans, that we're strengthening those relationships, and that we're exploring all opportunities to make sure that Manitobans get access to the best health care possible.
Premier, the MLA for Fort Garry did not shake your hand during the swearing-in ceremony. Did you have a conversation with him? Does that bother you in any way?
No.
Are you okay with him continuing to work in his lawyer practice? He said he would continue to do that.
I think everyone who's been elected by the people of Manitoba should focus on serving the people of Manitoba.
Are you suggesting he would not be doing that if he's devoting some of his time to his law practice?
I think all of us should understand that public service is more than a full-time job.
Is that the reason he wasn't appointed to cabinet?
When we put cabinet together, there's so many different dimensions and considerations that I would say the biggest challenge we have on our team is the bench strength we have. There are many, many MLAs on our team who, in fact, everyone, I would say, could serve as a minister. But at the end of the day, we made a few decisions. One of them was to shrink the size of cabinet. And as a result, there's some decisions that have to be made about how many people can serve in that capacity.
Will you require Mr. Wasiliu to give up his law practice?
I don't think I'm sharing any news on that today.
What about other MLAs? I mean, they've had businesses, they've, professions that they continue with. Why should he have to give up his legal practice?
Well, I think that I'm saying the expectation is first that you will treat your MLA work as more than a full-time job.
Did he express any disappointment about not being chosen for cabinet?
I typically keep private conversations between myself and the other individual.
Okay, we have no more questions in the room. There's a question from the Brandon Sun on Zoom.
Okay.
Speak out into the room. We'd like to go to Zoom now.
Hello.
Hello.
Good morning,
Hello.
Michelle. Go ahead.
Thank you. Hello, Premier Kinew and Minister Asagwara. Just a question about the timing of the letter. Why today? Were you getting pushback in the last couple of weeks, or was this in the plan to release this all along?
I'll tackle that first. As Premier has stated very clearly, one of our earliest priorities is to make sure that healthcare workers across the province know that we want to work together and that we want to strengthen the relationship with them. It's a values statement. It is expressing very clearly what our team's commitment is to healthcare workers and to Manitobans who depend on healthcare workers to provide great quality care. And so, our full team was just sworn in yesterday. And, we've already been working hard and coming out today to hit the ground running and make sure that healthcare workers hear our message is an incredibly important step that Premier Kinew made sure that we were taking.
Okay. Any other questions here?
Just maybe a point of clarity. This is an open letter. Are workers getting this in their email inbox?
Yes.
That's it.
So.
It's in the news release. My apologies.
Oh, okay.
Go ahead.
Well, if it's in the release, I won't belabor the point, but yes, we've shared the letter with all the service delivery organizations across the province, like Shared Health, Regional Health Authorities, and et cetera, and asked them to distribute this to the healthcare workforce, but also trying to share the message publicly through every avenue that we have.
Just a question about harm reduction. Where does it fall on your priority list right now, and what are the first steps to trying to increase the number of detox or treatment beds in Manitoba?
Harm reduction is a very important aspect of healthcare. We've been very clear about respecting the healthcare workers across our province who deliver harm reduction-based services and are out every single day saving lives and supporting families to ensure that folks who are struggling with problematic substance use addictions, untreated or unaddressed traumas and mental health issues are getting the supports and services they need. Harm reduction is healthcare, and our government is committed to ensuring that harm reduction is treated as healthcare across our province. Premier Kinew has taken steps to establish a department that will be focused on that aspect of healthcare, obviously in conjunction with my office as the Minister of Health. And our whole team, values that approach, and Premier Kinew is setting the tone for that, which is very, very important.
Will you be getting a COVID shot, flu shot? Will you be making a public display of it?
Yes, you may have seen some of our, team members already posting vaccination shots. I believe that I will be doing a photo op to this effect on Friday. Apparently not. Anyway, it'll be coming in the next few days. I'll be doing the photo op part of it, and in the hopes of maybe taking some of the politics out of it, I'll be leaving the public commentary on this fall's vaccination campaign to Dr. Rusin.
And you said that the accountability starts and stops with you, with the elected officials. Mm-hmm. You mentioned briefly about emergency department wait times. Yeah. Being worse that they've ever been. Do you want to elaborate on that? When will you reduce the wait time? Do you have a target for getting the wait times down to the Canadian average or something? What can you tell us?
Well, wait times continue to go up. There's a pretty clear trend line where not only is it the worst on record, but it's also continuing to increase at a pretty dramatic slope, if we all remember our rise over run math lessons. And what I would say, though, is that the first goal, the first target we're going to set for our team is to stabilize the situation. So the goal is absolutely to reduce wait times, but the first step and the goals around staffing up and hiring and deploying resources into the hospitals with emergency rooms is going to be towards achieving that first step of stabilizing the situation, and then to assess our progress on the go so that we can then move to reducing wait times.
When do you expect to have the wait time stabilized?
I would hope that we can produce results right away in the coming months.
You've got nurses. We did that recruiting trip to the Philippines. Now that you are in government, is something like that, would you pursue another trip, or do you think that's not an option you would pursue?
We are going to have to find a way to recruit healthcare staff, nurses, healthcare professionals, aides, physicians from every approach at our disposal. And certainly there was a lot of fanfare and press releases from the previous government. But if you look at the amount of net new people at the bedside, you haven't really seen progress. And so we are going to have to deliver on that priority area because, as I said, everything we want to do in healthcare starts with the staff working at the front lines. And right now, we are in a need of finding more people, whether that's through appealing to recently retired people, people who've moved into agencies, people who've left the province, newly trained folks to join the front lines. It's going to have to be an all-of-the-above type approach.
So an international recruiting trip is all of the above?
It could potentially be within that range of tools.
Pouvez-vous répéter ça en français, s'il vous plaît, votre approche sur le fait d'aller recruter à l'étranger?
Ben, nous avons besoin d'utiliser tous les outils pour notre équipe. Et ça pourrait inclure parler avec ceux qui ont juste pris leur retraite, ceux qui ont quitté la province, ceux qui ont peut-être déménagé, et peut-être, oui, des opportunités internationales, mais nous n'avons pas de nouvelles de partager sur ce côté maintenant.
Minister, what's your status as a nurse? People have asked, are you still registered? What is your official professional status?
I've made very clear I'm very proudly a registered psychiatric nurse. It's very important to me that folks know my background. It's part of establishing that relationship with Manitobans and healthcare workers, and them also knowing that our premier makes decisions to try to best position folks to deliver on our goals in a good way. My top priority is the top priority of the premier and of our team, which is to fix the healthcare that Manitobans are counting on. My top job is being the Minister of Health and working with healthcare workers across the province to ensure that their morale is boosted, that they continue to work in our healthcare system. We're hoping we can bring folks back to our healthcare system in Manitoba and the public system. And so, it's a tremendous honor to be the Minister of Health. I take the responsibility incredibly seriously, and our team is committed to working with healthcare workers across the province to strengthen healthcare and to make sure that their voices and expertise are respected. And so, my past experience as a nurse on the front lines, I think lends itself very well to working with healthcare workers and nurses and understanding their experiences so that we can make the changes and investments that they need to see.
Okay.
All right. Thanks, everyone. Have a great day.